All right, welcome back, everybody. We are back with Sako today, and as promised, we're going to do a follow-up Q&A from the webinar that we did last week. If you didn't get a chance to make that webinar, we're going to link it down in the box below, so you can go and check that out for a more in-depth look at all of these modern addictions that we're talking about today. But today, we had a lot of questions that came in from the webinar, and we didn't get to them all, so that's why we're here today. Just a reminder that Sako comes to us from Begin Again Institute, which is in Berthoud, Colorado. BAI provides 14-day residential intensives for men 25 years and older, struggling with sexual addiction, hypersexuality, compulsive behaviors, and intimacy disorders. BAI uses the TINSA model, which is trauma-induced sexual addiction, and that's a neurobiological approach to treating the root cause of addiction. So the intensive also includes a partner support program for betrayed partners of sex addicts at no additional cost. You can learn more about BAI at beginagaininstitute.com. And with that, Sako, how was that? That was a nice little pitch for BAI.
Thank you.
Let's dive into some of the questions because there were a ton of them. And, we only had an hour and a half for the webinar. So let's get into some of these. Do you want to introduce yourself again really quick?
Yeah, sure. Yeah. I'm Sako. I'm one of the primary therapists in the program, which means I'm one of the folks who works with clients who come through the program. So they'd be working one-on-one with me and within groups. I've been working in the addictions field for 8 years now. Started in the first couple of years in co-occurring. Actually, the first 2 years was on a acute psychiatric unit, so did a lot of psychiatric mental health care. So that's why I like to bring that piece into my work. And I've worked with substance addictions and with process addictions, which has given me a good variety of the clients and experience that I've had, and I see the overlap between them and the co-occurring nature of these things for people, and that's part of why chose to focus on that topic. So that's a little intro about me. I think I mentioned in the webinar as well, which you should go check out if you haven't. But I work in private practice as well. I'm mentioning that because I get to see people on an outpatient basis as well, right? So kind of more of that individual weekly over months to years for some. So I also get that perspective within the work. So yeah.
Awesome.
Yeah.
All
I appreciate the questions.
Well, thanks for being here for the follow-up. So I'm just going to dive right in. And I really love the first question because I think you have a really good way of defining this. So when we're talking about these addictions or other addictions, what defines an addiction?
Yeah, it's a great question. And we can get super duper technical with it. And there's debate within the addiction field on part of what it looks like. But the short answer for most people and most clinicians is addiction is a pathological, so an unhealthy relationship with a substance or behavior that continues to persist despite negative consequences. And the American Society for Addiction Medicine, if you go check out their stuff, has a definition, and they talk about there being strong trauma and genetic underpinnings to addiction. And so that's what defines it. And addiction is often marked by what we call the 4 C's. And the 4 C's are there is compulsivity, which means I'm engaging in the behavior automatically more than I want to. And there's this urge to want to use, right? So I'm doing it compulsively. There's craving present. So the urge that we were talking about when I'm not using it, not engaging in it, there's this angst within me, this pull towards it that feels like it's driving me even when I don't want to. That's fogging part of my thinking and judgment around it. There's a loss of control. So loss of control is tricky because people think oh, well, my whole life is out of control. And that's rarely the case that one's whole life is out of control. It could get there, but it could be loss of control around this behavior, loss of control over the impact of this behavior, loss of control about when I'm engaging in it and when I'm not, right? Or what I'm looking at or what I'm using. So that's the loss of control piece. And then consequences, right? There's negative consequences within myself, the people around me. And with process addictions, part of why it's tricky to spot for some people, and process addictions are behavioral addictions, right? So pornography, video games, food, gambling, screens, right? And with process addictions, there's less consequences, visible consequences. So people have a harder time spotting it in that way.
Yeah, great. Are there apps or organizations that directly address some of these addictions? And I'll just say those addictions was pertaining to the ones in the title of the webinar, which is weed, games, phones, and porn.
Yeah, good question. As far as like video games and screens go, I don't know of like a larger organization that addresses this issue. Often, if you go like, if one goes and Googles and looks up even like on Reddit, there's communities that one can find around that. And so those are not organizations, but they're communities of people. As far as sex addiction goes, ITAP, which is the International Institute of Trauma and Addiction Professionals, who are the folks who certify us, the certified sex addiction therapists, which is one of my credentials. They're an organization. And then of course, clinically, there's, organizations like Begin Again Institute and Boulder Recovery that do work around treating addiction, from a more clinical perspective versus from like an external community support perspective. Yeah. And then of course the 12-step communities. There's specialized 12-step communities. There's Internet and Technology Addicts Anonymous, ITAA meetings. There are SAA, Sex Addicts Anonymous meetings. And there's also smaller, kind of more fringe programs like Porn Anonymous, but that's just not a very big community. There's Sex and Love Addicts Anonymous, right? Just as like for there's Marijuana Anonymous for cannabis addiction, and then the other ones that people know about, like for substance and harder drugs. There's Narcotics Anonymous, Alcoholics Anonymous, but then also like Dharma Recovery Dharma and Life Ring, and there's sober active communities like the Phoenix that does work not directly on these addictions, but just like addiction in general. Often they're oriented towards substances. Yeah.
Cool.
Yeah.
How can we approach porn addiction without shame? And I think we did address this a little bit during the webinar, but I think it'd be great to talk about it here too.
It's an awesome question. And I think it's often at the core of sexual compulsivity, right? Our culture has shame around sexuality. I think one of the ways is to normalize it. I think, as I mentioned in the webinar, like integrating it more into part of our intakes, the language, like them even seeing books that we have on the topic, like sends signals that like, I'm a person who knows about this, or I'm like kind of safer to speak to in this area. I can mention that other people or clients have struggled with similar things. Like, many people struggle with video game addiction and pornography addiction. I don't want to tell anybody. I think they're like, either like the only one or that there's a lot of shame around it. Just kind of mentioning it in like passing and not directly towards them can really help. So normalization and then exploring the roots of shame itself within the person's life are pretty important, because the shame is not just often rooted in the piece of addictive compulsivity around sex or porn, but in other parts of their life, they just generally have trauma that has created shame for them in other places. Because part of what happens is if I'm a shameful person, then I get to do like shameful person things. And if I have a shameful framework about like pornography is a shameful thing to do, or sexual compulsivity is a shameful thing to do, and I'm a shameful person, I get to do that thing, right?
Mm-hmm.
So, yeah.
Yeah, that's really good. I love this question because I think this could be helpful for a lot of people, but what are some signs and symptoms to look out for, specifically when it comes to porn addiction? Because I think that one, the person who asked this question had a extra little part about it, because this one tends to live in such shame and, darkness and just, something that someone's really hiding.
Yeah. Well, as I mentioned in the webinar, if there's this sense that like you're missing a piece, like a person is relapsing on their, let's say they're trying to maintain sobriety from cannabis or marijuana and screens, but they keep relapsing, become curious about that potentially going on in the background, right? If you're seeing impacts to the way they relate, or they're not building relationships with others. Well, pornography is often a pretty isolative, for example, like cocooning thing for people. The other thing, which they may or may not talk about, is porn-induced erectile dysfunction is often common amongst millennials and Gen Z, which is that essentially erectile dysfunction caused by the overuse of pornography, which overloads the brain and introduces a level of stimulation that the brain and body is not built for. And when they're trying to engage in healthy sexuality with others, let's say, things are not working. So if you hear about like erectile dysfunction and the person, let's say you're working with, identifies as male and they're 23 years old, something's likely up, you know? And they've seen a doctor about it, let's say, something's likely up. Yeah.
Yeah. What are the best interventions for these modern addictions?
Yeah, I think part of this was addressed within the webinar itself. I talked about the various areas of stuff to focus on. I think some of it is not different from other addictions, right? So motivational interviewing, for often in individual therapy, group support, so a therapy group around these difficulties if it's available, mutual support group programs, like I talked about, like 12-step programs that exist around this. Often building community around these addictions is really key, because one, with video game addictions, like it's frequently about isolation. It's this isolative activity. And same thing with a sexual compulsivity and intimacy disorders, which take people out of intimacy and connection. So the building of a community, we talk about steeping oneself in a culture of recovery is often key. So community-based interventions, but then also, right, we talked about addressing mental health struggles, which we'll talk about in some of the questions here, I think. Some of those symptoms are some of the effective interventions. And then in the webinar, I talked about even some medications that help with this stuff. So those are some of the best interventions.
Yeah. And I know at Begin Again, when we're talking specifically about intimacy disorders, sexual addiction, porn addiction, we like trauma resolution or modalities. Brain spotting is one that we use a lot. A lot of mindful meditation or psychodrama, things like that too.
Yep.
All right. What kind of licensure or certifications do your clinicians have? So they're talking about specifically at Begin Again Institute. And have you worked with interventionists?
Yeah. So as far as licensure, like we have licensures, and like I'm a licensed social worker and licensed addictions counselor, and my peers are licensed professional counselors, and also some of them are licensed social workers. And but we're certified sex addiction therapists, CSATs. And some of us are in different places in that journey of credentialing, right? And just those are some of the certifications that we have. As far as gaming and screen addictions, I don't know of an official certification that exists yet. Like I imagine that some do, but there isn't like this better recognized national or international organization that certifies folks for gaming and technology and screen addictions yet. Yeah, so that's a potential avenue. Have we worked with interventionists? We have. And typically, if an interventionist is involved, where the family is recruiting the help of an interventionist, it indicates typically like a severity level and a need for inpatient treatment, right? So inpatient and step-down treatment. So just something to throw out there. That may not be the case every time, but often if there's an interventionist involved, yeah, that's what it would look like. Yeah.
Yeah. If someone's working with a client that is dealing with these addictions, what are some really good objectives or strategic objectives to have for the work they're doing together? To do in therapy.
Yeah. I think some of this was in the webinar, right? Covered in the webinar. So take a look at that if you haven't. We talked about addressing, mental health, creating goals, like as far as like connecting with their value systems, finding their why in recovery, looking at their patterns, like breaking down what occurs and how they engage with these substances and behaviors, like at the nitty-gritty, like a behavior chain analysis. If you've heard of that, you can look that up. But those are some important goals. But then, like I talked about earlier, building community, not doing this by oneself, getting involved in that community, developing honesty within that community, because the honesty and vulnerability of being involved in a community decreases the shame, and the decrease of the shame helps with the maintenance of sobriety and recovery. And then, of course, for those where it's appropriate, for some folks, they don't have underlying trauma. Let's say they became addicted via this like more modern framework of it was just exposure to video games and screens and pornography that created it. But if they do, then addressing the trauma work is also very, very important, and understanding the attachment wounds that often underpin addiction. Because if I don't have healthy attachments within my life, I can become attached to these substances and behaviors, or attempt to attach to them.
Yeah. I'm going to use that opportunity to just plug our next webinar, which is with Matt Winger, who's your colleague. And he's going to be doing his webinar on attachment, trauma, and sex addiction. So
yeah, and what an
that'll be
awesome
good.
job he does of that. I think that'll be really valuable if you all can attend.
Yeah. All right. How do these co-occurring addictions affect individuals with existing mental health diagnoses? And then just as a tag along with that one, someone also said, can you address the possible overlap between sex addiction and bipolar disorder? And they also asked about autism, if you want to address all of that in one.
Totally. I think this was talked about within the webinar itself to a significant degree. So as far as addressing the overlap, I think what I said was like finding care for both of those things simultaneously, like both the mental health factors and the addiction, is like key. And that includes for ASD, right? Autism spectrum disorders. Now with autism, there's some special considerations around looking at, hey, is this really like, is this about compulsivity, or is this about like a self-soothing mechanism that the person has developed within their pattern around, like, let's say like sensory overload? So it's about teasing out some of those things, which is a more complicated matter, right, to look into. But yeah, so there's a lot of co-occurrence between mental health and addiction. In fact, I run off the operating assumption that most people with addictions, like over 80% of them, have a co-occurring mental health condition. And as far as bipolar disorder goes, well, with bipolar disorder, especially with the hypomania and mania piece, that has to be addressed, I think, actually kind of first, because one has to figure out whether the person's sexual compulsivity is happening as a result of them being in a hypomanic or manic phase, because hypersexuality and a really high libido are a symptom within the diagnostic criteria for bipolar disorder. So essentially working with a psychiatrist, typically almost always getting on medications for bipolar disorder are key, because if that resolves the issue of the sexual compulsivity, then one can know that it was kind of largely based in that. But it can happen that a person has both, that they have bipolar disorder, and that often does happen, and sexual compulsivity. Yeah.
Do you think the definition of what constitutes porn and sex addiction has changed in a world where sex is promoted now more than ever?
Yeah. Well, addiction itself hasn't changed. Like the root, and we talked about the definition of it earlier, the nature of the illness has not changed. What has changed are the avenues of access, the normalization, like we talked about in the webinar, around people having this issue going on and having awareness around it, but not having much of an urgency to do something about it. And so the avenues of access, the way in which people become addicted has changed, but the nature of the addiction itself has not.
Yeah. Thanks for clarifying that.
Sure.
Do you think, this is pretty specific, do you think there's any evidence that the vaping epidemic may tie into problematic behavioral issues?
Yeah, it's a legitimate question. I don't have any specific research that I can cite on like the overlap between these two. My guess would be that those who are more likely or are currently dependent on vaping products or other nicotine replacement products also have a higher propensity and likelihood to develop sexual compulsivity or become addicted to something like pornography. So I would imagine that's the overlap. Yeah.
Okay. Yeah.
Yeah.
All right. Next question. It's a long one, so I need to like.
And video games too, I should say, like video games as well, right? Those who are compulsive around uh, vape products are probably also, more likely to be compulsive with screen use, video game use. Yeah.
Yeah. Well, I like this next question for you because of you being a Colorado resident. But what are some strategies for marijuana addiction in states where it's legal for recreational use? And how do you approach the belief that it's not addictive or not as addictive as other substances like alcohol?
Yeah, I think the matter of it being legal or not is not really the question. And like for example, like someone could be addicted or compulsive around food. That's not a matter of whether food is legal or not, right? Same thing with alcohol. Alcohol has been pretty much legal always outside of like the prohibition. And that's not what makes it addictive or not. So I think basic motivational interviewing is what helps at exploring and resolving ambivalence, letting the individual experience consequences, right? Like the consequences of one's addiction are an important motivating factor in what gets people to shift and change. And so those are some of the ways in which one can work with it, because if we're like, I think some level of client education can be helpful, but one has to be really tactful that the person is receptive to it, because or else it can come off as like lecturing or, we're trying to like steer them in a certain direction, which if a person is addicted and is ambivalent, often backfires. Yeah.
Yeah.
Mhm.
How do you address pornography addiction in couples therapy?
Yeah, I think part of the answer is often you don't. Um,
Mm.
you address it more in individual therapy. In the context of couples therapy, and this is not for every couple, this is not in every situation, but there's a very high likelihood that the shame around it and the social pressure will result in them not being completely truthful about that issue within the context of the couple's work. So exploring it more on an individual basis, if it's sniffed out that, hey, that's something that's going on, referring to an individual therapist is really, really important, where it can be explored and the extent of it can be seen. I think what couples therapy can help with is around kind of that collateral piece of having another individual whose perspective you're hearing around this struggle, saying, hey, it's not just affecting you, but you're saying that it's just, you're using like, pornography, let's say, and you're saying that's just about, it affects you. It's like, that's not true. It's also affecting me. Like, so it can help challenge the person's perceptions and distortions.
Mhm.
So that's the way it can be utilized. But oftentimes, couples work in the context of sexual compulsivity and pornography addiction is we don't typically do couples work early on. We do individual work, and couples therapy only comes about after there's been a baseline and foundation of established um, honesty and truth, disclosure around what's occurred that the partner can like trust in and believe in. And there's some evidence that the person is making changes, because often betrayal trauma is common with sexual compulsivity,
Mhm.
which maybe it's not a factor for every single couple, but it is for many. And that has to be addressed before the couple's work can move forward. Yeah.
Yeah. Yeah. All right, two more questions.
Yeah.
What are some common disorders associated with these co-occurring addictive and compulsive behaviors?
Yeah. I think spoke about this in the webinar itself, right? So check that out. I explore this in further detail, but ADHD is really common. Bipolar disorder is common. Access to personality disorders are common. Um, and uh, high anxiety is common.
Mm.
So folks medicating their anxiety, depressive disorders. So major depression, for example, all of those overlap frequently with addiction, and increasingly what's been observed is autism spectrum disorder. Yep. Mhm.
All right, last one.
Yeah.
Can addictive behaviors be overcome, or are they always in the background?
Yeah, it's a great question. Um, so yes, they can be overcome and that they can be treated, and a person can live firmly in recovery and long-term sobriety, or set up a lifestyle where even if they're having slips with video game addictions or screen addiction or pornography addiction, that they're, as a batting average, that's getting longer and longer, or they're getting healthier and healthier, and the impact of it, the harm to their life. We talked about the goal of harm reduction as well. That's very possible. Many people are living that way. Now, as far as a cure, we usually don't use the word cure, like this is removed out of a person's brain for good, because addictions are very tricky, and the reintroduction of the substance or the behavior, some people can tolerate it, but oftentimes it results in a resurfacing and exacerbation of old symptoms. That's why alcoholics in recovery, for example, even if they've been 15 years sober, typically are not like, hey, like I can have a glass of beer like 15 years later, because it'll often reactivate it. Yeah. So, yep.
Cool. All
But
right,
people
you
can
did
get
great.
well and stay well. And that's what we help them with at BAI. So
Yeah,
we'd love to be able to, you know, help some of your folks if it fits.
agreed. Well, thank
Yeah.
you for doing this for us, Sako. I think
You're
it's,
welcome.
you know what, it's quitting time.
Yeah.
At least it is
Cool.
here in Nashville where I am. So
Yeah.
with that, thank you so much. For anyone watching this, if you want to learn more about Begin Again Institute, reminder, you can go to beginagaininstitute.com to learn more about our services and learn more about Sako. So,
Cool.
all
Awesome.
right. Thanks, Sako.
Thanks, Tara.
Bye.
Later.